Hi everyone, I'm Dr. Avni Ratan. I'm a consultant clinical psychologist and I'm a faculty at Conceptual Psychology. I'm here today to help you with the answer key to NIMHANS recall paper for M.Phil Clinical Psychology exam. So as many of you messaged me stating that the exam was heavily dominated by biopsychology, hence we have the expert faculty Dr. Praveen Tripathi, who's a consultant psychiatrist and faculty at Conceptual Psychology, joining us today to help you with the biopsychology shortly after this session. So let's just start with what we have gathered through the recall. So the first question is the backward digit span test, where participants must repeat a sequence of number in reverse order, is primarily used to assess which type of memory system. So here the correct answer would be that the backward digit span test primarily measures working memory. So that is specifically the central executive component of Baddeley's working memory model. So unlike forward digit span, which mainly tests the passive storage capacity of the phonological loop, the backward digit span requires active manipulation and processing of information. Here, the participants must not only hold the digit sequence in mind, but also mentally reverse the order before responding. So this dual requirement of storage and manipulation, it is the hallmark of working memory function. The test is particularly sensitive to the frontal lobe dysfunction, and it is also commonly used in neuropsychological assessments to evaluate executive cognitive abilities. I hope this is clear. We'll be moving on to the second question, which is that in psychoanalytic theory, what term describes the mental representation of psychic energy being invested or attached to a particular object, person, or idea? So here the options are libido, cathexis, fixation, and sublimation. So the right answer would be cathexis, which is the psychoanalytic term that describes the mental representation of psychic energy being invested or attached to a particular object, person, or mental representation. So here it is attached to a specific person, object, or mental representation. So it is also derived from the Greek word which means to occupy or to hold. So cathexis, it represents how the libidinal energy becomes bound to specific targets in the mind. For example, we can also think of when someone forms an emotional attachment to another person, they are said to have a cathected that person with psychic energy. So the concept is fundamental to understanding how psychological conflicts develop when energy becomes overly invested in inappropriate objects or when decathexis, which is the withdrawal of energy, occurs inappropriately. I hope this question is clear. Moving on to the third question. Here, when data is assumed to be normally distributed and meets the assumptions of equal variances, which category of statistical tests is most appropriate to use? First is non-parametric test, second is parametric test, then it's the chi-square test, and last is the distribution-free tests. So here the correct answer would be parametric tests. Why? Because parametric tests are used when data is assumed to be normally distributed and it meets certain statistical assumptions which include normality or homogeneity of variance and independence of observations. So these tests, they make specific assumptions about the population parameters and the distribution of the data. So the common parametric tests here would include the t-tests. For comparing means between the groups, it would also include ANOVA, which is analysis of variance for comparing multiple groups. Then the Pearson correlation. Here we measure linear relationships and linear regression. So parametric tests are generally more powerful than their non-parametric counterparts when their assumptions are met, meaning they are better at detecting true differences or relationships when they exist. Moving on to the next question. So when comparing two independent samples and the data does not meet the assumptions for parametric testing, which non-parametric test is most commonly used? So here the options are Wilcoxon signed rank test, Mann-Whitney U test, Kruskal-Wallis test and Friedman test. So here the correct answer would be Mann-Whitney U test. And why? So Mann-Whitney U test is also known as the Wilcoxon rank sum test. So it is, another name for it is Wilcoxon rank sum test. Now, why is this the correct option? Because it is the most commonly used non-parametric test for comparing two independent samples, right? So, it helps in comparing two independent samples. So, this test is the non-parametric alternative to the independent sample t-test, and it is also used when data does not meet the assumptions of normality or when dealing with ordinal data, right? This is also used while dealing with ordinal data or when the data does not meet the assumptions of normality, when the assumptions are not met. Moving on to the next question. So in the Wechsler Adult Intelligence Scale, 4th edition, how many core subtests are there in Verbal Comprehension Index and in the Perceptual Reasoning Index, respectively? So here, the Wechsler Adult Intelligence Scale, the fourth edition, it was restructured, and the verbal IQ and the performance IQ frameworks were considered in 4 index scores. So the Verbal Comprehension Index, which is also known as the VCI, it contains 3 core subtests, and the Perceptual Reasoning Index, PRI, has again 3 core subtests. So here the VCI has similarities, vocabulary and information. So VCI has 3 core subtests, similarities, vocabulary and information. Whereas the Perceptual Reasoning Index, it also has 3 subtests, which is block design, then matrix reasoning, and visual puzzles. I'm sure you all must have conducted this by now in your master's practical classes. So here the correct answer would be option B, 3 verbal and 3 performance tests. So this also represented a shift from the Wechsler Adult Intelligence Scale 3rd, where the Perceptual Reasoning Index replaced the traditional performance IQ and it includes more fluid reasoning tasks. So the 4th edition also includes 2 additional indexes. One is the Working Memory Index. So this is for your additional knowledge, that the additional indexes, may say the first one is the Working Memory Index. And the second one is the Processing Speed Index. So here, this one also has 2 subtests and this also has 2 subtests, which makes a total of 10 core subtests. Hope this is clear. Let's move on to the next question. The next question says that the Vineland Social Maturity Scale is used to assess adaptive behavior and social component. It does not have which of the following characteristics? A. Age appropriate item selection. B. Applicability from 0 to 25 years only. C. Separate forms for different age groups. And D. Standardized scoring procedures. So the VSMS scale and its modern version, which is the Vineland Adaptive Behavior Scales, do not have a limited applicability of only 0 to 25 years. Alright, the current Vineland 3 actually has a much broader range. It covers individuals from birth to 90 years, which makes it useful across the lifespan. So this extensive age range allows for the assessment of adaptive functioning in infants, children, adolescents, adults, and even elderly individuals. So the scale assesses adaptive behavior across many domains. What are those domains? One is communication. Then we also look at the daily living skills. Post this, socialization, and in younger ages we also look at motor skills. Right, here it would be in younger population. So it provides a comprehensive picture of an individual's functional abilities relative to their age peers. So the correct answer here would be, again, it would be option B, applicability from 0 to 25 years only. Next question. So Cattell's 16 PF, 16 Personality Factor Questionnaire is primarily designed to measure which psychological construct? A. Fluid intelligence, B. Crystallized intelligence, C. Personality traits, and D. General intelligence, which is the G factor. So here, Cattell's 16 PF is not a assessment tool which caters to assessing intelligence. Okay, so the 16 PF measures 16 primarily personality factors, right? As the name only suggests for itself, that it looks at the personality factors. Some of them could be warmth, then it's reasoning. What else? Emotional stability, post which we look at dominance, then liveliness, right? We also look at social boldness, sensitivity, vigilance, abstractness, and so on. So we look at 16 personality factor, right? So while Raymond Cattell is also famous for his work on intelligence theory, so what was his major contribution was the distinction between fluid and crystallized intelligence. So here he was also, Raymond Cattell was famous for giving the distinction between the fluid and crystallized intelligence. But the 16 PF, this focus is on personality dimensions rather than cognitive abilities. So here we are not looking at cognitive abilities, but only the personality factors. So the test provides a comprehensive profile of an individual's personality structure based on a factor analytic research. Okay, let's get on to the next question, which says, according to Piaget's theory of cognitive development, abstract reasoning and hypothetical thinking abilities are primarily developed during which developmental stage? A. Sensory motor, B. Preoperational, C. Concrete operational, and D. Formal operational. So, according to Piaget's theory, abstract reasoning develops during the formal operational stage. This is the stage which is approximately 11 years to adulthood. So here, this is the final stage of cognitive development where individuals acquire the ability to think hypothetically, right? They are able to think hypothetically and they are able to engage in deductive reasoning. Also, they can consider multiple variables simultaneously. Alright, they can think about abstract concepts that are not tied to concrete objects or experiences. So here in this stage, the key abilities that emerge, they include the scientific reasoning, they include the systematic problem solving, they also include the propositional thinking and the capacity to consider what if scenarios. So this stage allows the individuals to think about thinking itself and to manipulate abstract ideas mentally without needing concrete reference. So when this stage allows itself to think about itself, then it is known as metacognition. So the correct answer here would be formal operational stage. Hope that's clear. The next question is, according to Erikson's psychosocial development theory, successful resolution of autonomy versus shame and doubt stage results in the development of which virtue? So here in Erikson's psychosocial developmental theory, successful resolution of the autonomy versus shame and doubt stage, it results in the virtue of will. So firstly, the autonomy versus doubt stage is approximately 18 months to 3 years. So here, during this stage, the toddler begins to assert their independence by exploring their environment and making choices for themselves. So here they are making choices for themselves by exploring their environment. So when caregivers encourage self-sufficient behavior while setting appropriate limits, children develop a sense of personal control and the confidence to make their decisions. Okay, so the virtue of will, it represents the child's emerging sense of determination. Here there is an emerging sense of determination. Then there is also a sense of self-control and the ability to exercise the choice and restrain. So if this stage is not successfully navigated, children may develop feelings of shame about their capabilities and they may doubt their ability to make independent decisions if it is not successfully navigated. All right, moving on to the next question. So, according to Erikson's psychosocial development theory, a child who is 1 year, 5 months old, which is approximately 18 months, would be in which developmental stage? A. Trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, industry versus inferiority. So, a child who is 1 year, 5 months old, 18 months approximately, is in the autonomy versus shame and doubt stage. I did mention the age range in the previous question itself, so we could get an idea of the answer from there. So here, according to Erikson, psychosocial developmental stage, it would be autonomy versus shame and doubt. This stage typically spans from 18 months to 3 years. So at 18 months, children are beginning to develop a sense of personal control and independence. So they start to assert their will, they make choices like what to wear or eat, and they explore their environment more independently. So independent exploration of environment. So during this stage, toddlers are learning to do things for themselves, right? What would they learn now? They would learn to walk, climb, open things, right? And saying no. Choice and restraint. So successful navigation of this stage leads to the virtue of will, which we discussed previously, and a sense of autonomy, while failure can result in feelings of shame and doubt about one's abilities. Next question. So according to Carl Lashley's research on memory storage, where did he conclude that memories are primarily stored in the brain? A. In specific localized brain regions which are dedicated to particular memories. B. Distributed throughout the entire brain cortex. C. Exclusively in the hippocampus. Or D. Only in the frontal and temporal lobes. So here, Carl Lashley concluded that memories are distributed throughout the entire brain cortex. Okay, so rather than being stored in specific or localized regions, his theory stated that the memories are distributed throughout the entire brain cortex. Through his extensive research, which involved maze learnings in rats, so he was popular by this research in which rats learned how to navigate through mazes. It was also followed by systematic brain lesions. So here Lashley formulated two key principles. One was the principle of mass action, which is memory deficits are proportional to the amount of cortical tissue destroyed regardless of the location. Okay, so the more the cortical tissue is destroyed regardless of the location, the more the memory deficits will happen. Alright, so that was the first principle. The second was the principle of equipotentiality. Here it would be, the second one is the principle of here, all parts of the cortex, they contribute equally to complex learning and memory. All parts of cortex contribute equally to learning and memory. So his search for the engram, he searched for the engram, which is the physical memory trace. It led him to conclude that memory is a distributed function which involves multiple brain areas working together rather than being housed in one of the cortexes. Alright, so the correct answer is it is distributed throughout the entire brain cortex. Moving on to the next question. So, which of the following is not a characteristic of a normal probability curve, which is a normal distribution curve? A, the curve is symmetric around the mean. B, the mean, median and mode are all equal. C, the curve has two distinct peaks, which is bimodal. And D, the total area under the curve equals 1. So as we all know that the normal probability curve is unimodal, meaning it has only one peak, not two distinct peaks. Right. So the characteristic bell shape of the normal distribution has a single maximum point at the mean, with the curve tapering off symmetrically on both the sides. Right. So a bimodal distribution here, which is having two peaks, it represents a completely different type of distribution and is not characteristics of normal probability curve. So the bimodal distributions often suggest the presence of two different populations or underlying processes within the same data set. Okay, so the correct answer here is the curve has two distinct peaks. It is not a characteristics of a normal probability curve, because a normal probability curve is unimodal, having only one peak. Now, moving on, the measurement of children's height represents which level of measurement according to Stevens' classification system? A, nominal level, B, ordinal level, C, interval level, and D, ratio level. So here we are asking about a child's height. So height measurement represents the ratio level of measurement, which is the highest level in Stevens' classification system. So height has all the properties required for ratio measurement. Why? Because it has equal intervals, right? The difference between 100 centimeter and 101 centimeter is the same as between 150 centimeter and 151 centimeter. So a true 0 point, it has a true 0 point. So 0 height means complete absence of height over here. And it has the ability to make meaningful ratio comparisons, right? So the third thing is it makes a meaningful ratio comparison. So a child who is 120 centimeter tall is exactly twice as tall as a child who is 60 centimeter tall. So that's a meaningful ratio comparison. So the ratio level measurements, they allow for all mathematical operations. They include addition, subtraction, multiplication and division, making them the most informative type of measurement. Hence, the correct answer is the ratio level. The next question. Which parenting style is characterized by the combination of giving emotional support, setting clear boundaries, and maintaining accountability for children's behavior? First is authoritarian parenting, B, authoritative parenting, C, permissive parenting, and D, neglectful parenting. So here the correct answer would be, you need to start with authoritative parenting. It is characterized by the optimal combination of high responsiveness. So here we would quickly revise the characteristics of the parenting styles. So authoritative is high responsiveness, that means emotional support and warmth. Then it is also characterized by high demandingness. Right, which means clear boundaries as stated in the question, right, and accountability. So authoritative parents, they provide emotional support by being warm, nurturing and responsive to their children's need. So they establish clear boundaries by setting consistent rules and expectations, and they maintain accountability by following through with appropriate consequences when rules are broken. Okay, so this parenting style is associated with the most positive outcomes in children, including higher self-esteem, better academic performance, lower rates of behavioral problems, and better social competence. So the correct answer is authoritative parenting. Moving on to the next question. When two variables that are being used as predictors in a statistical analysis, they have a high correlation with each other. This statistical problem is known as A, heterosidicity, B, multicollinearity, C, autocorrection, and D, homogeneity of variance. So here the answer would be, the correct answer is multicollinearity, because it occurs when two or more predictor variables in a statistical analysis, here two or more variables in a statistical analysis, particularly in regression analysis, are highly correlated with each other, has a high correlation with each other, right? So this creates several problems. What are the problems that it creates? That it becomes difficult to determine the individual effect of each variable. So it's very difficult here to determine the individual effect of each variable. Standard errors of regression coefficients become inflated. Okay, so here the standard error of regression coefficient will become inflated. Here the confidence intervals also become wider. So when the confidence intervals are becoming wider, then the model becomes unstable, right, which could lead to large changes in the coefficients. So the perfect multicollinearity makes it impossible to obtain a unique estimate of regression coefficients, while high multicollinearity makes these estimates unreliable. So this problem is detected using measures like variance of inflation factor, VIF, or tolerance values. So here the correct answer is multicollinearity. The next question. So in an experimental research using ANCOVA, which is analysis of covariance, a covariate should ideally have which type of relationship for optimal statistical control? A, curvilinear relationship with dependent variable, B, curvilinear relationship with independent variable, C. Linear relationship with dependent variable, and D. Linear relationship with independent variable. So, a covariate should ideally have a linear relationship with the dependent variable. Why? Because this linear relationship is crucial as it allows the covariate to effectively reduce error of variance by accounting for systematic variation in the dependent variable. So when the covariate is linearly related to the outcome, and COVA can use this relationship to make more precise estimates of group differences. So here there is more precise estimate of the group differences, right? Because it statistically removes the variance attributable to the covariate. So the stronger the linear relationship between covariate and dependent variable, the greater the reduction in error term and the increase in statistical power. So here the statistical power also increases when this relationship is stronger. So the covariate should not be related to the independent variable, which is the treatment, to avoid the confounding the treatment effects. Okay. So let's move on to the next question, which is conditioning that uses reinforcement paired with the stimulus that is below the sensory threshold, subliminal, is known as classical conditioning, subliminal conditioning, backward conditioning, and trace conditioning. So the answer is already there in the question itself. So the correct answer is subliminal conditioning. It refers to the conditioning that occurs when the reinforcement is paired with the stimuli that are present below the sensory threshold, right? Here it is, below the sensory threshold. It is self-explanatory as well. This means that the stimuli cannot be consciously perceived by the individual. It can't be. So these subliminal stimuli are very weak. They are brief, or maybe they are masked to reach the conscious awareness, yet they can still influence the behavior and learning. So research also shows that even when people cannot consciously detect the stimulus, their nervous system may still process the information at an unconscious level, allowing for conditioning to occur. So this type of conditioning, it demonstrates that learning can happen without conscious awareness of the conditioning stimulus. So we can still learn while, there is no conscious awareness about that conditioning. So the correct answer here is subliminal conditioning. Moving on to the next question. The cognitive bias where an individual believes that thinking about a negative event, such as I think my daughter will get into an accident and she will get into an accident, will actually increase the likelihood of that event occurring, is called magical thinking, thought action fusion, confirmation bias, or catastrophic thinking. So here the correct answer is thought action fusion. Thought action fusion is a cognitive bias. So here the individuals believe that their thoughts can directly influence the external events, or that thinking about something increases the probability of it happening. I thought of it, it might happen. So there are two main kinds of this. One is the likelihood thought action fusion. So it's likelihood thought action fusion, right? Where a person believes that thinking about a negative event increases its probability of occurring. Thinking increases the probability of occurrence That is the first kind. The second is the moral thought action fusion. Here, a person believes that having an immoral thought is equivalent to performing the immoral act. If you have an immoral thought, it is equal to performing the immoral act. So these are the two kinds of thought action fusion. So the example given, it represents the likelihood of thought action fusion commonly seen in obsessive compulsive disorder. आपको ये OCD में भी सुनने को मिलेगा, या फिर it also happens in generalized anxiety disorder. It could also be a part of GAD. And sometimes in other anxiety related conditions also. So this cognitive distortion, it could lead to significant distress and avoidance of behaviors, and sometimes the individuals also try to suppress these dangerous thoughts. The next question. So according to Piaget's cognitive developmental theory, the process of modifying or changing existing schemas to fit new information that cannot be assimilated into current mental structures is known as assimilation, accommodation, equilibration, or organization. So here, so in the past exams also, we always get a question either on assimilation or on accommodation. So the answer to this question is accommodation, which is the cognitive process where individuals modify or change their existing schemas. What are schemas? A mental framework. So here the person would change their existing schemas to incorporate new information that cannot fit into their current understanding. So when new experiences, they contradict or cannot be explained by existing schemas, accommodation requires the restructuring. Then you restructure these mental frameworks to make sense of the new information, right? So the existing one is getting changed. Here we could also explain it through a brief example. Is a child who believes all four-legged animals are dogs. It must accommodate their schema when they encounter a cat. So it creates a new category for cats as distinct from dogs. So this process, it is very essential for cognitive growth and adaptation. It allows the individuals to develop more sophisticated and accurate understanding of the world. So the correct answer is B. Moving on. So according to the hierarchical classification of defense mechanisms, which of the following is considered an immature defense mechanism, typically seen in adolescents and adults with personality disorders? A. Sublimation, B. Acting out, C. Repression, and D. Humor. So this is also one of the most important questions which we see that examiners keep on asking on repeat. So you need to be very, very thorough with the concept of defense mechanisms. So here there are two kinds. One is immature, the other is mature. The immature one over here is the acting out defense mechanism, which is classified as immature defense mechanism, where individuals express unconscious conflicts of feelings through actions rather than words or conscious awareness. So this defense mechanism, it involves impulsive behavior, it serves to the discharge of the tension without addressing the underlying emotional conflict. The person is not addressing the underlying emotional conflict. It is commonly seen in adolescents, particularly in borderline and antisocial personality disorder, and sometimes in substance abuse disorders as well. So there are other immature defense mechanisms also, which include passive aggression, projection, regression, and hypochondriasis. So these mechanisms, they provide temporary relief from anxiety, but they often create interpersonal problems and they fail to resolve the underlying conflicts constructively. The correct answer is acting out. The next question. Borderline personality disorder is most characteristically associated with which primary defense mechanism? Repression, splitting, sublimation, and rationalization. So here it is splitting. Splitting is the hallmark defense mechanism of BPD. So this primitive defense mechanism, it actually involves viewing people, situations, or even oneself in all good or all bad terms with no middle ground or integration of the positive and negative qualities, right? It's all good or all bad, black and white, no grays. So individuals with BPD frequently they oscillate between idealizing somebody, they see them as perfect, and devalue them, seeing them as completely worthless. This is often triggered by minor disappointments or perceived abandonment. So this is black and white thinking, which extends to the self-perception, which extends to the relationships and even situations. Splitting helps the person to avoid the anxiety of ambivalence. So the person is able to avoid it, but it severely impairs the relationship stability and emotional regulation. So other related defense mechanisms in BPD apart from splitting is the hallmark, but apart from splitting up, projective identification, devaluation, and even idealization. All right. I hope this one is clear. Moving on. So here the concept of Dasein, which refers to human existence as being in the world and emphasize themes of authenticity, freedom, and mortality, is primarily associated with which school of psychology? Behavioral, existential, cognitive, or psychoanalytic? So here, this is a central concept in existential psychology. It is derived from the German philosopher Martin Heidegger's existential philosophy. It literally means being there. Means being there or being in the world. So means being in the world. So here it refers to the unique human capacity for self-awareness and conscious existence. So in existential psychology, it emphasizes the human existence of authentic existence confronting freedom and responsibility. So here it is an authentic existence which caters to the freedom. It is confronting freedom and responsibility. So here the correct answer is existential psychology. So dealing with existential anxiety about death and meaninglessness and the search for personal meaning and purpose, this was propagated by existential therapists like Rollo May, Irvin Yalom, and Viktor Frankl. They have incorporated this concept to help clients explore the fundamental questions about their existence, their choices, and the human conditions. The next question. According to Piaget's theory of play development, what is the first stage of child play that emerges during infancy? Symbolic play, functional play, games with rules, or constructive play? So, functional play, also known as practice play or exercise play. Functional play is also known as practice play or exercise play. It is the first stage of play development according to Piaget's theory. It emerges during the sensory motor stage. So it emerges during the sensory motor stage, which is 0 to 2 years of age. So this type of play, it involves repetitive motor actions. So it would involve repetitive motor actions and sensory exploration. So here the infants and toddlers, they engage in simple repetitive behaviors for the pleasure of activity itself. So what are the examples of this? It could include banging the objects, shaking rattles, splashing water, or repeatedly dropping the toys. Functional play, it also helps children develop motor skills. They understand the cause and effect relationship and they explore their environment through direct sensory experience. So this foundational stage of play is very crucial for early cognitive and physical development. So the correct answer is functional play. Moving on to the next question. So in existential psychology, DASI encompasses three fundamental psychological dimensions of human existence. Which of the following correctly identifies these three modes of being in the world? A. Ego and superego. B. Umwelt, Mythwelt and Eigenwelt. C. Conscious, preconscious and unconscious. And D. Sensory motor, preoperational and concrete operational. So the three fundamental dimensions of DASI are Umwelt, Mythwelt and Eigenwelt. So Umwelt refers to the biological or the physical world. It's the physical world. Okay, so our relationship with the natural environment, our bodily needs and the biological drives. Mythwelt, here it represents the social or interpersonal world. This is social or interpersonal world. Here are relationships with the other people, social interactions and shared cultural meanings. Eigenwelt, it encompasses the personal or the individual world. Okay, so our relationship with ourselves, self-awareness, personal identity and the inner psychological experiences, right? So Eigenwelt would be the personal or the individual world. It is personal or individual world. So these three dimensions, they originally conceptualized by Ludwig and later these were developed by the existential psychologists like Rollo. So this represents the complete spectrum of human existence and the different ways we exist being in the world. We also discussed about being in the world, that DASI means being in the world in the previous question as well. Hope that's clear. Moving on to which of the following is not a recognized Rorschach-Ing-Block test scoring system? Beck, Exner, Murray or Klopfer? So the answer is easy, it's Murray. So Murray is not associated with Rorschach scoring systems. Henry Murray is famous for developing the thematic apperception test, the TAT, which uses ambiguous pictures to assess personality dynamics, needs and interpersonal relationships. So TAT is a completely different projective assessment tool from the Rorschach-Ing-Block test. So Murray's contributions to psychology, it includes the need theory along with TAT. But he did not develop a scoring system for Rorschach tests. So the major Rorschach scoring systems include Exner's comprehensive system, the Klopfer system, the Beck system, and the Rappaport system. Next question. Which psychological test would be most appropriate for measuring the IQ of a 5-year-old child based on chronological age norms? Now, many of you got confused between two options, which I will share later. So, the correct option is BKT. It's Binet-Kamat test. It is the most appropriate choice for measuring IQ in a 5-year-old child. Why? Because the BKT is an Indian adaptation of the Stanford Binet Intelligence Scale. It is specifically designed for children aged 3 to 22 years, making it ideal for preschool age children. So it also provides the chronological age-based norms. So here, when you talk about the chronological age-based norms, then this is the culturally appropriate content for Indian populations. So the test assesses various cognitive domains. It includes verbal reasoning, abstract reasoning, quantitative concepts, and memory, with age-appropriate items that can accurately measure intellectual functioning in young children. Right, so many of you answered Malins instead, but here the question focuses on chronological age norms, which are very clear-cut given in BKT. Binet-Kamat test. Yes, moving on. The original Stanford Binet intelligence scale, Stanford Binet 1, used which method for calculating IQ scores? Deviation IQ with standard scores, ratio IQ, which is mental age upon chronological age into 100, percentile ranking system, or T-score transformation. So the original Stanford Binet intelligence scale, it used the ratio IQ, which is mental age divided by chronological age multiplied by 100. So this method, it was developed by Lewis Terman. Questions on intelligence are very important. They keep on getting repeated every year. We see a large number of questions from intelligence and personality. So this method was developed by Lewis Terman at Stanford University in 1916. It was based on Alfred Binet's concept of mental age. So the intellectual level at which a child functions compared to the average performance of children at chronological age. So, for an example, if a 10-year-old child performed at the level of an average 12-year-old, their IQ would be calculated as 12 divided by 10 into 100, which is 120, right? So, this ratio method, it was revolutionary for its time, and it provided a standardized way to compare intellectual functioning across different ages. Next question. According to Gordon Allpott's personality theory, what are considered the basic building blocks of personality? So just when I said that paper always consists of intelligence and personality questions, we witness another one. So here the options are unconscious drives and conflicts, traits, behavioral patterns and conditioning, and cognitive schemas and belief. So according to Allpott, traits are the fundamental building blocks of personality. He defined traits as the consistent patterns of behavior. Traits were the consistent patterns of behavior, even for thoughts and for emotions. So, the traits characterize an individual across different situations and over time. So, Allpott also categorized the traits into 3 levels. One was the cardinal, which was the rare, and it was also the dominant characteristic, which would define a person's entire personality. Second was the central. Here 5 to 10 basic traits that that form the foundation of personality: honesty, sociability, anxiety. So here 5 to 10 basic traits come into the picture, and then secondary traits. So what are secondary traits? They are more specific traits that appear only in certain situation. So they are situation specific. Okay. So Alport also emphasized that traits are real neuropsychic structures within individuals, not just descriptive labels, and they actively guide and motivate the behavior. The correct answer is traits. Next, which of the following theoretical concepts is not primarily associated with Sigmund Freud's psychoanalytic theory? A. Oedipus complex. B. Biosocial theory. C. Psychosexual development. And D. Defense mechanisms. So the correct answer is biosocial theory, because rest three are related to each other. So biosocial theory is not associated with Sigmund Freud's psychoanalytic framework. Biosocial theory, it emphasizes the interaction between the biological factors and the social environmental influences. So this theory talks about the interaction of the biological factors and the social environmental influences which shapes the human behavior and their psychological development. So this approach is associated with theorists like Marsha Linehan, who developed the biosocial theory of borderline personality disorder. Here, this is more in congruence with theorists like Marsha Linehan rather than Freud. Also, Karen Horney, who emphasized social and cultural factors in neurosis, and the modern developmental psychologists also integrate the biological and social perspective. So Freud's psychoanalytical theory, it primarily focused on the intrapsychic conflicts, the unconscious drives, and the psychosexual development, with less emphasis on the social environmental interactions. Okay, so another one would be Karen Horney. All right, moving on to the next one. Which of the following theoretical concepts is not primarily associated with Carl Jung's analytical psychology? The shadow archetype, the personal unconscious, the Oedipus complex, and the collective unconscious. So here again, the last question gives us an idea. The correct answer is Oedipus complex. So Oedipus complex is not associated with Carl Jung's analytical psychology. It is a central concept in Sigmund Freud's psychoanalytical theory. The Oedipus complex, it describes a child's unconscious sexual attraction to the opposite sex or to the parent, and the rivalry with the same sex parent during the phallic stage of psychosexual development. So Jung actually disagreed with Freud's emphasis on sexual motivation and developed his own concepts. So while Jung initially collaborated with Freud, he eventually broke away to develop his own theoretical framework, focusing on the spiritual and the archetypical aspects of the psyche rather than primarily sexual drives. So here, this one is not associated with Jung. Moving to the next question. So, which personality inventory is directly based on Carl Jung's theory of psychological types? MMPI, MBTI, 16PF, or Neo-PIR? So, here the correct option is MBTI, which is Myers-Briggs Type Indicator, which is directly based on Carl Jung's theory of psychological types. Initially, it included the extraversion versus the introversion. Other than that, the 4 other psychological functions were also added, which were thinking, feeling, sensation, and intuition. Now, the MBTI has been expanded and it has 16 distinct personality types based on combinations of those preferences. Moving to the next question. According to Aaron Beck's cognitive theory of depression, the pattern of negative thoughts about self, world, and future that characterizes depressive thinking is known as cognitive distortions, cognitive triad, automatic thoughts, or dysfunctional assumptions. So, Arenbeck's cognitive triad, it describes the three key areas of negative thinking that characterize depression, which is the negative thoughts about the self, viewing oneself as worthless, inadequate, or defective, or the negative thoughts about the world experiences, interpreting experiences in a negative or a pessimistic way, and negative thoughts about the future, which is hopelessness and pessimistic expectations about what lies ahead. So, this is the triad that forms the core of Beck's cognitive model of depression. The correct answer here is the cognitive triad, which is hopelessness, helplessness, and worthlessness. So, moving on, the concepts of injunctions, counter injunctions, and games are fundamental components of which psychological theory? So, injunctions, counter injunctions, and games are the core concepts in transactional analysis. So, it is developed by Erik Byrne. So, injunctions are the early negative messages, which are usually the non-verbal type of messages. Then they are given to children that limit their natural development, such as don't exist, don't be you, don't succeed. Counter injunctions are the shoulds and oughts. So these are the conditional messages about how one must behave to gain approval. They often conflict with injunctions such as be perfect, try hard, please others. So these are counter injunctions. Now, games are repetitive, predictable patterns of social interaction with hidden agendas that end with negative feelings for all participants, serving to reinforce life positions and collect the psychological stamps. So these concepts, they work together in transactional analysis to explain how early childhood messages create lifelong patterns of dysfunction. So games here are the predictable patterns of social interaction with hidden agendas. All of this together create a lifelong pattern of dysfunction. So the concept of self-story or helping clients reauthor their life narratives is most closely associated with which therapeutic approach? Cognitive behavior therapy, narrative therapy, psychodynamic therapy, or gestalt therapy. So here it is self-explanatory that the answer is narrative therapy. Why? Because it is fundamentally based on the concept of your self-story or the narratives. All right. Moving on to the next question. Interpersonal therapy, IPT, does not typically include which of the following techniques or focus areas? Role playing and role reversal techniques, grief and bereavement work, role conflict resolution, and role transition support. So, IPT does not typically include role playing and role reversal techniques. So these are action-oriented techniques which is more in common with psychodrama. These are action-oriented techniques which are more commonly used in psychodrama. Whereas IPT is a structured talk-based therapy that focusing on improving interpersonal relationships, and it addresses specific interpersonal problem areas as well. So the therapy emphasizes the verbal exploration. It emphasizes on the verbal exploration of relationship patterns and communication skills and working through interpersonal difficulties rather than using the experiential or action-based technique. Moving on. According to Erikson's psychosocial development theory, the virtue of purpose emerges from the successful resolution of which developmental crisis? The virtue of purpose emerges from the successful resolution of initiative versus guilt crisis, which occurs approximately between 3 to 5 years of age in children, which is also the preschool age, right? So during this stage, children begin to assert power and they control over the world through directing play and other social interactions. They start to initiate activities, they make plans, and they tackle new challenges. When they are encouraged and supported in their initiatives, the child develops the virtue of purpose. They get the courage to envision and they pursue valued goals. So this virtue, it represents the child's emerging sense of leadership, direction, and the ability to set and work towards different objectives. But if the child is overly criticized or controlled during this stage, they may develop guilt about their desires and they become overly dependent. Hope that's clear. Moving on. According to Erikson's psychosocial development theory, the virtue of will, it emerges from the successful resolution of which developmental crisis? Trust versus mistrust, autonomy versus shame and doubt, initiative versus guilt, or industry versus inferiority. So here the virtue of will, it will emerge after the successful resolution of autonomy versus shame and doubt. So that's the correct option. It occurs approximately between 18 to 3 years, 18 months to 3 years. So during this stage, the toddlers, they begin to assert their independence by exploring their environment. They make the choices and they develop self-control. So when caregivers, they encourage self-sufficient behavior while setting appropriate limits, the children develop the virtue of will over here. They represent determination, they represent self-control, and they also represent the ability to exercise the choice and restraint. We've already covered this in previous questions as well. So this virtue, it reflects the child's emerging sense of personal agency and autonomous functioning. If the crisis is not successfully resolved, the child may develop feelings of shame about their capabilities and doubt about their ability to make independent decisions. Hope this is clear. The next question. According to Erikson's psychosocial developmental theory, the virtue of purpose emerges from the successful resolution of which developmental crisis? So here the virtue of purpose emerges from the successful resolution of initiative versus guilt, which is approximately 3 to 5 years of age, which is the preschool age. And during this stage, the child begins to assert the power and control over their world through directing play and other social interactions. They start to initiate the activities, they make plans, they tackle new challenges. When you support that child and their initiative, the child would develop the virtue of purpose. If it is not resolved or navigated properly, then the child may feel overly criticized or controlled during this stage, and they may develop guilt about their desires and become overly dependent. So B is the correct answer. Moving on. When the assumption of normal distribution is met and you want to compare the means of two independent groups, which statistical test is most appropriate? Mann-Whitney U-test, independent samples t-test, chi-square test, or Wilcoxon signed rank test? So when the data meets the assumption of normal distribution and you want to compare the means of two independent groups, the independent samples t-test here. Option B is the most appropriate parametric test because the test assumes that the data in both the groups are normally distributed. They have equal variances, which is homogeneity, and the observations are independent. Okay, so the t-test calculates whether the difference between the two group means is statistically significant, right? So here it calculates the difference between two group means whether it is statistically significant by comparing the observed difference to what would be the expected by chance alone. Okay, so when these parametric assumptions are met, the t-test is more powerful. The t-test becomes more powerful than the non-parametric alternatives. It means it's better at detecting the true differences when they exist. So the correct option is independent sample t-test. So an individual with an IQ score of 33 would be classified as having which level of intellectual disability according to standard diagnostic criteria. So an IQ of 33 falls within the range of severe intellectual impairment, which is typically defined as IQ scores between 20 to 25 to 35 to 40. So individuals with severe intellectual impairment, they require substantial support in daily living activities. They have significant limitations in conceptual skills, which is the academic learning is limited to basic concepts. Their social functioning is also impaired, and they may learn basic self-care skills and simple work tasks with extensive support and supervision. The severity classifications, they help determine the appropriate support needs and intervention strategies. So here the correct option would be C. So the next question, the behavioral technique that involves removing a desirable stimulus following an undesirable behavior in order to reduce the frequency of that behavior is called negative reinforcement, response cost, timeout, and extinction. So response cost is a form of negative punishment that would involve the removal of a desirable stimulus. For example, you could take privileges, tokens, points, or money following an undesirable behavior to decrease the likelihood of that behavior occurring again. What are the common examples? Losing television privileges for misbehavior, maybe paying fines for traffic violations, or losing tokens in a token economy system. So response cost is an effective way because it creates a contingent loss that motivates the individual to avoid the punished behavior. So this technique is widely used in behavioral modification programs, maybe classroom managements and therapeutic settings also, because it can be implemented immediately and it's often less aversive than positive punishment methods. So the correct answer here is response cost. Next would be habit reversal training, HRT, is primarily used as a behavioral intervention to reduce which type of repetitive behavior? Tics, stuttering, obsessive compulsive behaviors, and aggressive behaviors. So habit reversal training, HRT, is primarily used to treat tics, including both motor and vocal tics associated with Tourette syndrome and other tic disorders. So it was developed by Azrin and Nunn in the 1970s. So HRT is considered a first-line behavioral treatment for tic disorders. Now, at times it is also considered for stuttering, but it is not the first-line behavioral technique for it. Hence, the correct answer would be tics. So next question. Persistent preoccupation with perceived defects or flaws in physical appearance that are not observable or appear minor to others, causing significant distress or impairment in functioning is characteristic of which disorder? Somatic symptom disorder, body dysmorphic disorder, illness anxiety disorder, or conversion disorder. So, in body dysmorphic disorder, it is usually characterized by persistent preoccupation with perceived defects or flaws in physical appearance that are not observable or which appear minor to others. So individuals with BDD, they experience significant distress and they often engage in repetitive behaviors such as mirror checking, excessive grooming, skin picking, or seeking reassurance about for their appearances. So the common areas of concern include maybe perceived flaws in their face, in their hair, in their skin, in the nose or other body parts. So the disorder causes clinically significant distress or impairment either in their social, occupational or other important areas of functioning. It is also classified under obsessive compulsive and related disorders in the DSM-5 due to its obsessive compulsive features. So the answer is B. Moving on. Interaction effects between two or more independent variables can be detected and analyzed using which statistical technique? Correlation analysis, independent sample t-test, factorial ANOVA or chi-square test. So here factorial ANOVA is a primary statistical technique used to detect and analyze the interaction between independent variables. So an interaction effect, it would occur when the effect of one independent variable on the dependent variable depends on the level of another independent variable. So what could be the example here would be the 2 into 2 factorial design. Right. It is used to studying the effects of the therapy type. Let's just say we are looking at CBT versus psychodynamic. And we are also looking at effects of therapy type, which is CBT versus psychodynamic, and medication, which is present versus absent. So we are looking the effect on depression scores. So an interaction would mean that the effectiveness of therapy type differs depending on whether medication is present or absent, right? So factorial ANOVA partitions the total variance into the main effects. So individual effects of each other factor and interaction effects, which are the combined effects of the factors which are working together. So it provides the statistics to test the significance of these interactions. So here C is the correct answer. Moving on. Which statistical measure tells us how far individual data points are dispersed from the central tendency, which is the mean, expressed in standard deviation units? Variance, z-scores, coefficient of variation or standard error. So the z-scores, also known as the standard scores, they tell us how far individual data points are dispersed from the mean, which is expressed in standard deviation units, right? So here the correct answer would be z-score. Next question. Which parametric test is most commonly used to determine statistical significance when comparing sample means to test hypothesis? T-test, Mann-Whitney U-test, chi-square test or Spearman correlation. The t-test is the most fundamental parametric test used to determine the statistical significance when testing hypotheses about means. Alright, so always keep this in mind. So the t-test produces a t-statistic and corresponding p-value, which is then compared to the predetermined alpha level, which is typically that we look at 0.05, right, to determine if results are statistically significant or not. So the correct answer would be t-test. Now, according to Raymond Cattell's classification of personality data sources, which of the following is not recognized as a legitimate data type in his theoretical framework? Is it Q data, L data, T data or P data? So here in 16PF, we do not look at P data. It is not recognized as a legitimate part of Raymond Cattell's recognition classification system for personality data sources. So Cattell identified primary sources of personality data, which is the L data, which is life record data, observations of behavior in your natural settings, peer settings, biographical records, Then the Q data, which is the questionnaire data, self-reports, measures, and personality questions like 16 PF. And T data, which is the test data, which is objective tests where the person doesn't know whether the trait is being measured, such as reaction time or physiological measures. Alright, so here Cattell 16 PF was primarily developed using the factor analysis of these three sources, with the final instrument being a Q data measure, which is the self-report questionnaire. But it did not include the projective data. Moving on. So this is one of the favorite questions of the examiners. This is always a part of all the entrance exams. So in statistical hypothesis testing, rejecting a true null hypothesis represents which type of error? So here the correct answer is type 1 error, which occurs when we reject a true null hypothesis. So this means we conclude there is a statistically significant effect or difference when in reality no such effect exists in the population, which is also known as false positive result. So the probability of making a type 1 error is controlled by the alpha level commonly set at 0.05. So it means that we accept a 5% chance of incorrectly rejecting a true null hypothesis, which could lead to false conclusions about the treatment effectiveness. The correct answer is type 1 error. Now, the last question for today's session is Raven's progressive matrices RPM is primarily designed to measure which type of intelligence? So it was either it's crystallized, fluid, verbal, or social. So Raven's progressive matrices was designed to measure fluid intelligence. So fluid intelligence, it represents the ability to think rationally, right? Solve novel problems and identify patterns which are independent of previously acquired knowledge. So the RPM consists of visual geometric patterns which have missing pieces, which requires the test takers to identify the logical rule governing the pattern and select the correct completion from multiple options. So this test is also considered culture fair test because it doesn't rely on language or specific cultural knowledge or learned information. So instead, it taps into abstract reasoning, pattern recognition, and the ability to perceive relationships. So, which are all the core elements of fluid intelligence, hence the answer is fluid intelligence. So this sums up the recall questions for MPhil Clinical Psychology Entrance Exam 2025. For the biopsychology questions, now we'll have Praveen sir helping you clear your concepts. You could also download Conceptual Psych app and get the NIMHANS recall paper access for free, which would help you enhance your in-depth understanding as to which are the correct answers and why the incorrect answers are wrong. I wish you happy learning. Bye.
Hi, this is Dr. Praveen Tripathi, your faculty in Conceptual Psychology, and we will be discussing some of the questions, recall-based questions that were asked in the NIMHANS exam, the MPhil entrance exam. Alright, let's start. A 67-year-old man with mild cognitive impairment is brought to the clinic by his wife of 40 years. Alright. He appears calm and cooperative during the interview but repeatedly insists that woman accompanying him is not his real wife. The patient is saying that the woman who is accompanying him, who is actually his wife, is not his real wife, despite acknowledging that she looks exactly like her. He states, woman is identical to my wife in every way, but she is an imposter. My real life would never act in this way. He can provide accurate details about their shared history when prompted, but maintains this person is a duplicate who has replaced his actual spouse. What is the diagnosis? So There is a clear-cut case of delusion of misidentification. So if we talk about delusion of misidentification, basically the delusion involves the identity of the person. And we have got two most important syndromes in delusion of misidentification. What are they? We have got Capgras syndrome and we have got Frigoli syndrome. Now if you look at this Capgras syndrome, the name itself gives you a big hint. C stands for close, person, P stands for person, close person, G stands for got, R stands for replaced by a stranger. The patient believes that a close person got replaced by a stranger. This patient is saying that wife, who is a close person, has been replaced by an imposter who is looking exactly like her. So this is what happens in Capgras syndrome. Patient believes that a close person got replaced by a stranger, right? The Frigoli syndrome is the opposite. In Frigoli syndrome, patient believes that the close person is disguising as a stranger. In Capgras syndrome, patient is saying that this woman in my house who looks exactly like my wife is actually somebody else. This is Capgras syndrome. The Frigoli syndrome, the patient says that my wife is changing her appearance and she is disguising as a stranger. I'll give an example to make it easy. Say there's a patient. He has a delusion of persecution. He believes my wife wants to kill me. He also starts believing that wherever he goes, the wife follows him with some malintent. Later on, the patient starts believing while following me, the wife changes her face, the wife changes her appearance and disguises as a stranger so that I am not able to identify her. So what is the history that you will get? This patient goes to a random female and starts fighting with her. He says, you are my wife. You are changing your face, you are following me and you are changing your face so that I cannot identify you. And the patient says that wife can take multiple different appearances. Today he fights with one woman, tomorrow he fights with another woman, accusing her of being his wife. This is all Frigoli syndrome. So I hope you remember it. I mean, in such cases, the best way is to remember one and remember that the other one is the other one. So we remember Capgras full form, close person got replaced by a stranger. Other one is close person is disguising as a stranger. So the answer is Capgras syndrome. Frigoli syndrome we have talked about. Achha, please remember that this delusion of misidentification can be seen in patients with dementia. It is of course seen in patients who have schizophrenia, but it can be seen in patients with dementia. Your examiner has given you history of 67-year-old male with MCI, mild cognitive impairment, but this is something that you have to remember. What is Cotard syndrome? There was another question in the same paper in NIMHANS for Cotard syndrome, but remember in Cotard syndrome, basically you have nihilistic delusions, delusion of nihilism or nihilistic delusions. We'll talk about nihilistic delusion in the question on the Cotard syndrome. Alright, second question. A 28-year-old woman presents to emergency department with sudden onset paralysis of her right arm following a heated argument with her spouse. So we have a stressor. We have a stressor in this question, stressor being the argument with spouse, followed by a neurological symptom. Which in this case is a motor symptom in the form of paralysis. Now, neurological examination reveals no objective findings consistent with organic pathology. MRI is normal, nerve conduction studies are normal. Most remarkably, the patient appears surprisingly unconcerned about her paralysis, stating casually, it's not really bothering me much. This clinical presentation of apparent indifference to significant physical symptom is most characteristic of which disorder? So, they want you to make a diagnosis of this particular finding. I'm sure many of you must have answered this question. We know that if we have a patient who had a stressor followed by some kind of neurological symptom and there is nothing that you can find on neurological examination or on the imaging, the diagnosis goes towards the conversion disorder. In conversion disorder, patients present with neurological symptoms. What kind of neurological symptoms? There can be motor symptoms. Like this patient is presenting with paralysis. There can be sensory symptom. A patient may come and say, I cannot see. There can be seizures, right? All these things can happen. So neurological symptoms, but the cause is psychological. And this particular phenomena that they are talking about, it is called as labile indifference. Labile indifference. What is labile indifference? Lack of concern. Lack of concern for the symptom. It appears as if the patient does not care. A patient comes to you, she says, I cannot see with my right eye for last 2 days, but doctor, it's okay, doesn't matter, it's all good because my left eye is still working. As if she does not care about loss of vision in one eye. This lack of concern with the symptom is labile indifference, and it is characteristic of conversion disorder. Alright. A 28-year-old woman presents with periods where she exhibits completely different personalities, each with distinct names, memories, and behavioral patterns. During these episodes, she has no recollection of events that occurred while the other personality was present. She reports finding clothes in her closet that she didn't buy, receiving phone calls from people claiming to know her by different names. What is this? I think it's as simple as that. This is DID, Dissociative Identity Disorder, also called as MPD, Multiple Personality Disorder. Multiple personality disorder or dissociative identity disorder. Not a common disorder. You will rarely see these kind of patients in your clinical practice. In fact, most of the patients of DID have been seen only in the western part of the world. So what is DID? The patient presents with multiple personalities. Multiple personalities. Sometimes also called as altered states. Altered states. And usually these personalities are unaware of each other's existence. Unaware of each other's existence. When one personality comes, the second one leaves. When the second one comes, the first one leaves. This is usually what is seen, right? You must have watched that movie called Aparichit. It's a beautiful description of DID. One of the important differentials for these patients is dissociative trance and possession, right? In dissociative trance and possession, what happens? The patient's personality is possessed over by, or it is overtaken by another personality. Right? You must have seen people rotate their head and then they say that some goddess has come into me. That is dissociative possession, trance and possession. There the personality of the goddess has taken over the personality of the patient, and usually both personalities coexist. Here at one time only one personality will exist. Dissociative amnesia, as you know, it is characterized by inability to recall some personal event. So loss of autobiographical memory, some kind of autobiographical memory. Like say a patient had an accident, and in the accident say she lost both her parents. Now she has no recollection about that accident. In dissociative fugue, there is loss of memory and there is history of travel. There is history of travel, sudden unexpected travel. Say a patient is under stress and he lives in Delhi, suddenly he takes a train and he goes to Tamil Nadu, Chennai. And he has nobody over there in Tamil Nadu. He has nobody over there in Chennai, but he takes a train, goes to Chennai. Getting out at Chennai railway station, he does not have any recollection about things that happened in the past. This is dissociative fugue. In the newer classification, dissociative fugue has been made a classifier of dissociative amnesia. So broader diagnosis is dissociative amnesia. If there is a history of travel involved, you add dissociative amnesia with dissociative fugue. Earlier in the older classifications, they were different. So history of loss of memory, you have to think about amnesia. History of sudden unexpected travel, you have to think about fugue. And multiple personalities, DID. What happens in DPDR? Depersonalization, derealization, feeling of unreality of self and feeling of unreality of world. Feeling of unreality of self and feeling of unreality of world. So depersonalization is feeling of unreality of self. Patient feels unreal, and when the world starts feeling unreal, it is derealization. All right. Which of the following condition is not classified as neurodegenerative disorder? It's very simple. Epilepsy is not a neurodegenerative disorder. Parkinson's, Alzheimer's, Huntington's, all are considered as degenerative condition where there is loss of tissue. Epilepsy can be because of multiple causes, but it is not considered as a neurodegenerative disorders. The answer is C, epilepsy. Which of the following condition is not typically classified as a neurodevelopmental disorder according to standard diagnostic criteria? See, the term neurodevelopmental disorder is used for disorders which are characterized by abnormal development. When the child is growing up, there is something wrong with the development process. So ASD, autism spectrum disorder, is characterized by abnormal development. So is the case with ADHD and intellectual disability. So, okay, they're asking about not. So A, B and D are neurodevelopmental disorder. Which one is not? It is cerebral palsy. Cerebral palsy is not really a problem of development. It is caused by some external cause or something like, say, ischemia. Say the child did not cry at birth. Oxygen did not go into the brain. That is what is causing cerebral palsy. Right? Hypoxia, ischemia. It is not really a problem of development per se, but an event happened which is leading to the symptom. So cerebral palsy is the answer here. Which of the following is considered as a negative symptom of schizophrenia characterized by reduced quantity and quality of verbal expression? Quantity and quality of verbal expression. So we know that grossly we can talk about 6 negative symptoms in schizophrenia. We have avolition, we have apathy, we have anhedonia. What is avolition? Lack of drive for meaningful work. There's lack of drive for meaningful activities. Like the patient does not study, the patient does not go for a job, the patient does not earn money. There is no drive for any meaningful activity. Apathy is lack of concern. So there's a student who does not go to college. He fails the exam and now he's not even concerned about the results. That is apathy. Anhedonia, all of you know, loss of pleasure in previously pleasurable activities. Things that used to make you happy in the past are no longer making you happy. Loss of pleasure in previously pleasurable activities. Avolition, apathy, anhedonia. What next? You have got affective flattening. The emotional range has become flattened. Lack of emotional responsiveness. Lack or decrease in emotional responsiveness. Then you have got asociality. What is asociality? As the name suggests, lack of socialization, right? And finally we have alogia. Alogia is decreased verbal expression. So that is what the paper is asking about, decreased quantity and quality of verbal expression. So which of the following is considered? Yeah, so the answer here is alogia. Auditory hallucinations are considered as positive or psychotic symptoms. Delusions, of course, are positive or psychotic symptoms. So we have got hallucinations and delusions as psychotic symptoms. Disorganized behavior is, of course, a disorganization symptom, and alogia is a negative symptom. Negative symptoms are more often asked in the exams. According to the DSM-5 and in fact ICD-11, Asperger's syndrome is now classified under which broader diagnostic category? So earlier, when we talked about autism, so there was a category called as PDD, pervasive developmental disorders. We are talking about DSM-4. So in pervasive developmental disorders, we had multiple disorders. Like we had autism, we had Rett syndrome, we had Heller's syndrome or childhood disintegrated disorder, and we also had Asperger's syndrome. So the difference between autism and Asperger's syndrome were primarily in Asperger's syndrome, there was no language dysfunction. Otherwise, it was quite similar to autism. There was no language dysfunction. Later on, they said that it is very superficial to divide all these disorders. right? We did not have a strong basis to make these distinctions. So they combined everything. They combined autism, Heller's, Asperger's, and they make a single diagnostic category of autism spectrum disorder. Rett syndrome is now covered separately, but these others have been put together and they are called as autism spectrum disorder, ASD. So the answer is ASD. Which neuropsychological disorder is characterized by severe memory impairment and confabulation, typically occurring as a result of chronic alcohol abuse and thiamine deficiency? So the answer is very clear. It is Korsakoff syndrome. So patients who are alcohol dependent, who have alcohol dependence syndrome, when after a long period of time, because there is thiamine deficiency developing. Why thiamine deficiency? Intake is poor of thiamine and absorption is also poor. So it can lead to Wernicke-Korsakoff syndrome, which basically includes two things: Wernicke's encephalopathy and Korsakoff syndrome. Both of these are caused by deficiency of which vitamin? Thiamine, vitamin B1. Both Wernicke's encephalopathy and Korsakoff syndrome are caused by thiamine deficiency. What are the symptoms of Korsakoff syndrome? We have got amnesia. We have amnesia. Which kind of amnesia? We have both kind of amnesia, but anterograde amnesia is more prominent than retrograde amnesia. What is anterograde amnesia? Say I am teaching you and suddenly something falls on my head and I develop amnesia. I will have two kind of difficulties. I will find it difficult to make new memories. This is anterograde amnesia. I will forget things that happened in the past. That is retrograde amnesia. So both kind of amnesia develop. Anterograde is more prominent than retrograde. Now what happens? Say I have developed anterograde amnesia. I am not able to remember things. Say I come back home in the evening and the wife asks me, where were you the entire day? Now I do not remember anything. So I make a false story. I say I went to that friend and then both of us went to that park. So this false story that I am making to cover the memory gaps, it is called as confabulations. False story to cover memory gaps. This is confabulation. So they are features of Korsakoff syndrome. How do you treat it? It's caused by thiamine deficiency. So you have to give long-term thiamine, oral thiamine. According to ICD-11, what is the minimum duration requirement to make a diagnosis of schizophrenia? So according to ICD-11, to diagnose schizophrenia, you need 1 month duration of symptoms. DSM-5 on the other hand says that you need 6 months of symptoms to make a diagnosis of schizophrenia. 2 weeks is for depression and OCD. The major depressive disorder and OCD, 2 weeks. Right? ICD-11, 1 month. DSM-5, 6 months for schizophrenia. Which medication is considered as the gold standard mood stabilizer for the treatment and prophylaxis of bipolar disorder? If you talk about the gold standard, it has to be lithium. Lithium. So they are talking about both treatment and prophylaxis, prevention as well as the treatment. It has got to be lithium, right? Apart from lithium, the other medications that can be used for both treatment and prophylaxis would include valproate. But if they had talked only about acute mania, treatment of acute mania, in that case, we could have said that use either lithium and valproate. So lithium and valproate are considered as mood stabilizers. They stabilize the mood. They keep the mood euthymic. They prevent, mood going on the upper side of the range or the lower side of the range. They prevent manic symptoms and the depressive symptoms. So lithium and valproate is a mood stabilizer, and you can also use antipsychotics for acute mania. But they are talking clearly about both treatment and prophylaxis, so lithium becomes the better answer. Cotard syndrome, a rare condition, is characterized by which type of delusional belief? We talked about it. It is characterized by nihilistic delusion or delusion of nihilism. So not grandiose delusion, not persecutory delusions, it's nihilistic delusion. As the name suggests, nihilism, end. Patients develop belief that things are about to end. Patient may come and say that everybody is dead. The water has stopped flowing. The air has stopped flowing. Water is all frozen. Or patient may say something like, all my organs are rotten. right? So something to do with the end. Things are ending. Sab khatam ho raha hai. So this is nihilistic delusion, usually seen in patients with severe depression, and the name of the syndrome is Cotard syndrome. Cotard syndrome. All right. So these were the 11 questions. Thank you.
Hello friends, now we discuss question number 1. In phenylketonuria, the body fails to convert amino acid phenylalanine into which substance due to deficiency of enzyme phenylalanine hydroxylase. In phenylketonuria, enzyme deficient is phenylalanine hydroxylase. Normally, we know that phenylalanine is aromatic amino acid. This is aromatic ring. In our body, there is an enzyme. The name of enzyme is phenylalanine hydroxylase. This enzyme convert phenylalanine to tyrosine. Hydroxylase means joining of OH group, or hydroxylase, another name is monooxygenase. Monooxygenase. So normally phenylalanine is essential amino acid. Essential amino acid means must be supplied in our diet, and this phenylalanine essential amino acid is normally converted to tyrosine by enzyme phenylalanine hydroxylase. If this enzyme is deficient, then tyrosine will not be synthesized, and this disorder is phenylketonuria. So answer is tyrosine. In phenylketonuria, tyrosine will not be synthesized. Tyrosine is non-essential amino acid because it is normally synthesized in our body. But in phenylketonuria, it can't be synthesized. So question is asked, in phenylketonuria, tyrosine becomes essential amino acid. Essential amino acid. Normally in our body, tyrosine is further converted to melanin, black pigment, by enzyme tyrosinase. By enzyme tyrosinase. If tyrosinase is deficient, then disorder is albinism. Albinism means white hair, grayish of hair, white skin. Okay, so melanin will not be synthesized. So if a patient of phenylketonuria is there, this step would not occur. Tyrosine will not be synthesized. So melanin will not be synthesized. The patient will present with white hair, white skin of phenylketonuria also. So white hair, white skin present in albinism, also present in phenylketonuria. But in phenylketonuria, you will find that this phenylalanine will accumulate and will lead to mental retardation. Old name, according to DSM-5, name is intellectual disability. Intellectual disability. So patient will present with intellectual disability, mental retardation. Okay. So this is about phenylketonuria. Tyrosine, one more function. Tyrosine is converted to dopamine, norepinephrine, epinephrine. They are called as catecholamines. So in this question, we got simple answer that tyrosine will not be synthesized. Urea is NH2, CO, NH2. We know that ammonia is very toxic. In liver, by urea cycle, ammonia is converted to urea. So urea is synthesized by urea cycle. Liver, in liver. So it is not associated with phenylketonuria. Tryptophan is also aromatic amino acid. It is also essential amino acid. Essential amino acid, and it is metabolized to serotonin, which is further metabolized to melatonin. Histidine is a basic amino acid. Basic amino acid having positive charge. Not related to phenylketonuria. Answer is tyrosine. Now, question number 2. Which of the following hormone is not secreted by anterior pituitary gland? Pituitary gland, anterior pituitary gland, and posterior pituitary. So, hormones secreted by anterior pituitary are TSH, ACTH, prolactin, growth hormone, gonadotropin, include FSH, LH. So anterior pituitary, in this question 4 option has been given. Out of these, growth hormone is secreted by anterior pituitary, growth hormone, yes. Adrenocorticotropic hormone, ACTH also secreted by anterior pituitary. Thyroid stimulating hormone, TSH, also secreted by anterior pituitary. So remaining option is melatonin. Melatonin is not secreted by pituitary gland. It is synthesized in pineal gland. Okay, and formed from serotonin. As I discussed previously, that serotonin is converted to melatonin in pineal gland. So this is not secreted by pituitary gland. This is the answer. You must have an idea about the posterior pituitary hormone. Those are antidiuretic hormone and oxytocin. Question number 3. Which endocrine gland is primarily responsible for controlling the body's stress response and stress related metabolic changes? First of all, we go to answer. Adrenal gland is having adrenal cortex and adrenal medulla. Adrenal medulla release catecholamines, which is responsible for fight and flight response. In adverse situation. Adrenal cortex release glucocorticoids or cortisol mainly, and which regulate long-term metabolic response to stress. So I can say that adrenal gland primarily, they have given the word primarily responsible. Okay, so primarily that is adrenal gland. Adrenal medulla for fight and flight response, cortex, cortisol for long-term stress. Now other option, thyroid hormone or thyroid gland is regulating basal metabolic rate and release T3, T4, thyroid hormone. So thyroid gland is related to basal metabolic rate. Pituitary gland release ACTH. Okay, adrenocorticotropic hormone means it stimulates adrenal cortex. So it indirectly, yes, it act on adrenal cortex. But it is not the primary. It's not primary gland for stress response. We can say it has a regulatory role. Not effector role. So pituitary gland definitely affect this adrenal gland by ACTH, but the main function is being done by, yes, at effector level, the function is being done by adrenal gland. Okay, pancreas release insulin, it release glucagon, and it regulate blood glucose. So answer here, we will go with adrenal gland. Adrenal gland, primarily responsible for stress response. Next question, which endocrine gland is primarily responsible for controlling overall metabolic rate? I have just told you basal metabolic rate, T3, T4 secretion, thyroid hormone, yes, responsible for metabolic rate and energy expenditure. So answer, I will say thyroid hormone. We have discussed other option in the previous question, adrenal gland, adrenal cortex, adrenal medulla. Pancreas release insulin, glucagon, control blood glucose. Pituitary gland, anterior pituitary, posterior pituitary, hormones secreted by these glands we have discussed. So metabolic rate is controlled by thyroid gland. Now we come to question number 5. Which brain structure serves as primary control center for integrating the endocrine, visceral, and autonomic nervous system? First of all, endocrine role of hypothalamus. Answer is hypothalamus. We know hypothalamo, pituitary, adrenal axis, HPA axis. This is a neuroendocrine system. Means hypothalamus regulate pituitary, then it regulate adrenal gland, which release cortisol, and we know cortisol help the body to cope with stress. We have already discussed this question, that which endocrine gland is primarily responsible for controlling the body stress response at the level of effector level, that is cortisol, that is adrenal gland. Okay, again we come to endocrine role of hypothalamus. Now visceral role of hypothalamus, that is temperature, hunger, thirst, sleep. Autonomic role, it has role in regulation of heart rate and BP, heart rate, BP. So best answer is hypothalamus. Now we discuss other options. Cerebellum, involved in motor control, coordination, no endocrine role. So it can be ruled out easily, no endocrine role. Thalamus, it is major sensory relay station. Again, no endocrine role ruled out. Brainstem, control vital autonomic function. Just like heart rate, breathing. So out of these, best answer is hypothalamus. Next question, what is the alternative name for adrenaline, the hormone released by adrenal medulla during the fight or flight response? Similar topics, similar questions are being asked. We have already discussed that tyrosine is further converted to dopamine, norepinephrine, epinephrine. These are catecholamines. Norepinephrine is also called noradrenaline. Adrenaline. Epinephrine is also called adrenaline. So in this question, they have asked the another name of adrenaline, that is epinephrine. Non-adrenaline, norepinephrine. Okay. Cortisol we know responsible for stress response. So in this answer is B. Next question, which hormone is naturally secreted by body to act as an endogenous painkiller during stress, exercise, or injury? Endorphins. Endorphin is considered as endogenous painkiller. Other endogenous painkillers are enkephalin, dynorphins, Other option, yes, cortisol. We have discussed that adrenal cortex release cortisol and responsible for stress, but it's not endogenous painkiller. Okay, serotonin is neurotransmitter, and we know this is decreased in depression. And we have already discussed that tryptophan is converted to serotonin, is converted to melatonin. It is not endogenous painkiller. Next is adrenaline. It is not endogenous painkiller. I have given example: endorphins and caffeine, dynorphins. These are considered endogenous painkiller during stress, exercise, or injury. Next question is HTT gene, that is Huntington gene, which when mutated causes Huntington's disease, is located on which autosomal chromosome? Chromosome number 4. Short arm of chromosome 4 has HTT gene. Okay, so answer is A. This is the answer. We found that in Huntington's disease there is expansion of CAG, trinucleotide repeat. Expansion of CAG trinucleotide repeat means in normal person this CAG mean in DNA, in axon, we found that this trinucleotide is repeated multiple times, CAG multiple times. If it is repeated up to 35 times, it's normal. But if it goes beyond that, then it lead to Huntington's disease. And gene for that is at short arm of chromosome number 4. So simple answer is A. Other option which can be asked in further exams, chromosome 19, we found that gene for ApoE is associated or present at chromosome number 19, and it has association with Alzheimer's disease. Now chromosome number 21, we know trisomy 21 lead to Down syndrome. In Down syndrome there is mental retardation. New name is intellectual disability. According to DSM-5, ICD-10 mental retardation, DSM-5 intellectual disability. Chromosome number 15 is related with genomic imprinting and is responsible for Angelman syndrome and Prader-Willi syndrome. So question number 8, answer is A. Question number 9, Turner syndrome. In this question they have given Turner syndrome, a genetic condition affecting females. We all know the sex chromosome of female are XX, male XY. In Turner syndrome, we found that there is partial or complete absence of chromosome X. Okay, so answer is there is defect in the chromosome X chromosome. So Turner syndrome, X chromosome, there is partial complete absence. Now what are the symptoms of Turner syndrome? You will find short stature as given in the question. There is ovarian dysgenesis leading to infertility. They have given this point. Cardiovascular abnormalities, example, coarctation of aorta. There would be webbed neck. So these are symptoms of Turner syndrome. They have given the question and they simply ask that what is the defect, genetic defect, okay, and that is chromosome X, not chromosome Y. Chromosome 21, I told you, trisomy 21, Down syndrome. I told you in this there is intellectual disability, there is a characteristic facial appearance, mongoloid face is there. Chromosome 18, trisomy 18 lead to Edward syndrome. So in this question, answer is X chromosome. Next question. What is the primary function of myelin sheath that surround nerve axons in the central and peripheral nervous system? Option A, to provide structural support to the neuron. Definitely it is the function, it may be one function of a myelin sheath, but it's not the primary function. So it is, yes, myelin sheath support, structural support is there, but the main structural support is done by cytoskeleton and glial cell. So myelin sheath primary function is not to support, is not to give structural support. To increase the speed of nerve impulse conduction, this is true. We found that myelinated nerves have increased speed of conduction. Okay, so this is answer is B. This is the primary function. Other option, to store neurotransmitter for synaptic transmission. We found that neurotransmitters are stored in synaptic vesicles at axon terminal part, not in myelin sheath. So this is ruled out. To generate action potential in neurons, this is not the function of myelin sheath. Action potential is generated by neuronal cell membrane through opening or closing of ion channels. So in this question, you can say myelin sheath has role in the speed of nerve conduction. It increases the speed of nerve conduction. Action potential is generated by opening and closing of ion channel. Yes, neurotransmitter are stored in synaptic vesicles, not myelin sheath. It provides structural support, but is not the primary function. The structural support is given by cytoskeleton glial cells. So option B is the answer. Question number 11. Which revolutionary molecular biology technique allow researchers to precisely turn genes on or off by targeting a specific DNA sequence? One of the latest technique, that is CRISPR-Cas9, is the answer. Let me discuss CRISPR-Cas9 system or gene editing system. It causes double strand break. First point. What is the full form of CRISPR? Clustered, regularly interspersed, short palindromic repeats. Cas9 CRISPR associated endonuclease. What is the use of this CRISPR-Cas9 system, that is gene editing system? It can be adopted to be used in eukaryotes for the purpose like gene deletion. We can do gene deletion, exogenous gene insertion, multi-gene editing possible by this technique, altering gene transcription and regulation. They have asked same thing in the question. Yes, we are precisely turn genes on or off by targeting a specific DNA sequence. That is done by CRISPR-Cas9. You can find the answer by ruling out other option very easily. Option A, PCR, polymerase chain reaction, is used to amplify a target DNA. Suppose I give you a short DNA and I ask you to give me multiple copy of this target DNA. You can use it in a test tube or thermocycler, yes, and you can amplify this double-stranded DNA multiple times. Okay, 122, 224, 4 to 8, 8 to 16, means exponential growth would be there. In a short time, you will find multiple copies of target DNA. So this is the main function of PCR. It is not related to turn genes on and off, so you can easily rule out. Western blotting. Many times questions are asked and mnemonic is very simple. Snow, drop, or S for southern blotting, D for DNA, N for northern blotting, R for RNA. O से O कट किया. Western blotting for detection of protein. So southern blotting is done for detection of DNA, northern blotting is done for detection of RNA, western blotting is done for detection of protein. Okay, so this is Western blotting is used for detection of protein, is not related to turn a gene on and off. So easily ruled out. Mnemonic is snow, drop, or simple mnemonic. South ka dosa, north ki roti, west ka pizza. Gel electrophoresis. Gel electrophoresis is used to separate DNA, RNA, protein. It is used to separate DNA, RNA, protein. Yes, it is not related with genes on and off. So simple answer is B. You can easily rule out like this. Now we come to question number 12. Retinal disparity. If you know the other name of retinal disparity, you can solve the question easily. Retinal disparity, also known as binocular disparity. What is binocular disparity? You know, we have two eyes on our face and the position of two eyes are different. So for the same object, different eyes will make different images or different view from different angles. So we can write that position of two eyes are different on our face. This is correct statement. Yes. So give different view for same object. Same object. So we can say two different images for same object, and brain compare these two images. Brain compare these two images to calculate depth. Or you can say 3D depth perception. So I can conclude that this require cue or input, hint from both eyes. So classified as binocular Q as the answer, or binocular depth Q. So answer is binocular Q or binocular depth Q. Other option name itself tells you monocular static Q. Monoocular means related to one eye, related to one eye. Static means not moving, not moving. It is essential for depth perception and spatial awareness. But in this, one eye is involved. One eye is involved. Okay. Motion parallax Q. We found that nearby object or objects appear to move faster than distant objects when we move our head. So when we move our head, near object will move faster and distant object will appear moving slowly. Yes, just like you are traveling via train, the nearby things, yes, a pole will appear to be moving faster, but the mountain will appear to be moving slowly. Okay, so this is motion parallax Q. Pictorial depth Q. Pictorial depth Q. We found that object that appears smaller are perceived as farther. So this helps to show depth in 2D image. So this is about pictorial depth Q, motion parallax Q, monocular static Q we have discussed, and the answer is retinal disparity, another name by binocular disparity or binocular Q for depth perception. Thank you.